Suicide is the 10th leading cause of death in the world and here in the United States where I live. Despite the serious impact on public health, we've made relatively little scientific progress in understanding suicide in 50 years. There are promising breakthroughs using data science, both in understanding suicide and in possibly intervening in a suicidal crisis. And yet, despite that, we're at a real disadvantage. Mental health industry adopts technology practices about 10 to 15 years behind most other industries. And so the ability to get data, to implement innovation, and to have scientific and clinical breakthroughs is really impeded by our difficulties in integrating technology best practices into our organizational operations. We're here to talk about that today. I'm Dr. April Foreman. I'm on the executive board of the American Association of Suicidology, and I'm one of the founding members of the Technology and Innovation Committee. And I'm here to talk to you today about how all these innovations could possibly begin to be implemented in a meaningful way in most mental health organizations. Now, I realize many of you data scientists know some of the stuff that I'm going to be talking about today, but the goal is to give you some language or to organize this in such a way that you can help executive level leaders, the people with the power to say yes, more rapidly adopt some of these wonderful life improving and life saving innovations that we'll be talking about over the course of this conference. And so because there are 5-ish, let's get on to number 1. We need to educate executive leadership. What many executives may not realize in mental health is that AI is the new electricity. It's a real game changer in how most organizations are going to operate. And yet, just as electricity changed industry 100 years ago, most people have difficulty understanding how AI is going to integrate itself into our normal everyday workflows. And this has really got to start with education at the executive level. Executives have often very vague, inaccurate, or very polarized understandings of data science, AI, machine learning, all of that stuff. And so we have to work to help them understand what's going on. We neither want them to have a Harry Potter wizardry sort of AI will solve everything attitude, nor do we want to demonize it as the next thing that will come and go. I grew up, or I was an adult in the early 90s, and I remember people talking about how email was this trend and to not pay attention or to bother learning it. And yet most of us can't work now without email, without instant managing, without copious amounts of conference phone calls and video calls. It's just a different world, and we need the executives who lead mental health to understand that. The great news is that already, just in the last couple of years, there are now conferences helping executives from many industries understand the fundamentals of artificial intelligence, data science, natural language processing, things like that, and understand how to incorporate them in their regular business practices. Executives might need to understand how to put them into a strategic plan, how to build infrastructure to sustain them. And what many executives may not realize is that there are fundamental KPIs to organize this kind of work in their organization so they can manage it just like they manage any of their other service lines. So if we start there, we will probably get leadership will and leadership savvy to be able to be effective in these kinds of implementations. So once we've got buy-in, it's time to build an expert team. And so how do you get started with that? There may be a real desire right off the bat to hire just a ton of folks who are expert in AI or data science or machine learning. And that's actually probably not what you need to do. First things first, you've got to size up your data team. You probably, if you were a mental health organization, have a data team that understands your technology infrastructure and understands where data goes in your organization. And you need to augment that or build it out a little bit. Then you're going to need to look at hiring or getting consultation time of at least one really good dyed-in-the-world data scientist, machine learning expert, someone who knows about whatever sort of application you're planning to have in your organization. And this person can help leadership figure out what they need, work with the data team, and look for promising talent within your organization that you can possibly upskill. Because this is a field that's changing rapidly and there's always more to learn, you may have folks already within an organization who can acquire some of the necessary skills if you have a strong subject matter expert leader. Once you've got your team, it's time to size up your data. And I mean that in a couple of ways. This is my fun little pun. Most mental health organizations don't have a really good handle on the state of their data. So sizing up their data may be really very basically understanding the size of their data. Mental health organizations need to see where the data is in their organization, how much they have, where it lives, what characteristics it has. Data has all sorts of different types, as most people who are at this conference realize. But your executive team may need to know that that has to happen. So you would want to look at your current data infrastructure, and then you would want to look at the data needs, not just for what you have, because data you have is only part of the data that you might be using for an implementation. We're also looking at data that an organization can collect, data that an organization can get for free or cheap from outside the organization, and data that might be really useful to plan projects or implementations, but that might cost a premium so that they can decide, cost versus benefit. Is this data that I should or can purchase? And these are things that mental health organizations could consider with the help of their good subject matter expert. So once they've sized up their data, both the data that they have and the data that they plan to have or use in the next 5 to 10 years, what do they do next? They've got to grow their data infrastructure. And I love this graphic right here. I have walked into clinics with closets and closets of paper data that people didn't know what to do with, including paper printouts of electronic data they weren't sure how to store. And so when you're looking at a mental health organization that may have the data infrastructure of 10 or 15 years ago, we have to think how we can move from that level of infrastructure to the infrastructure of 10 years from now, where you want to be with the projects that you think are most important to the mission of your organization. When you are growing your data infrastructure, what should you be doing? Well, your AI team and your data team are going to need to work together to develop a data infrastructure growth plan that's going to really meet your strategic needs. What many executives don't realize is that there's a combination of strategies that are going to help you get there. You may be buying a commercial solution for your data infrastructure, and that depends on the use case. In mental health, however, there are not often pre-designed commercial infrastructure just like ready to come out of the box for our particular industry. Remember, we're often using data tools that are 10 to 15 years old. So there's often not the products that we need for the business that we do. So in that case, you may need to rent some infrastructure. So that's AI as a service, for example, or data science as a service. Many times executives don't realize that you can purchase some of this, and having your subject matter expert and data team advise your leadership team about this is very important. You might, for example, purchase just storage, or you might purchase storage with some AI or data science services, just some basic ones, all the way to carrying a lot of the AI or data science activities that you want to do under the direction of your one subject matter expert. It depends on the strategic plan and the resources of the organization involved, but they need to know that that's an option. And then, of course, many organizations either think they can buy something out of the box or think that they're going to build a bespoke, unique data science infrastructure entirely out of whole cloth. And that may be important for some organizations based on the specialty of their organization, specialty work they do, or the unique nature of their organization. And your AI team and your data team need to really help size that up and then provide some recommendations to your executive team and really provide plain language communication about how this works. So once you have an educated executive team, you've really assessed your data, you've built a team, you've grown your infrastructure, or at least you're in the process of growing it, what do you do next? Well, now it's time to plan projects. And this is really important because many of the folks who are at this conference understand how to do data science projects. They may have been on a project team, but it's important to understand those projects in the context of our larger organization. And this is where you're going to be educating the rest of your enterprise on what a data science team does or what stages a project might have. So, for example, and I'm just talking about, for example, a machine learning project, you might explain to your leadership, this project's going to have 7 stages. We're going to really define the problem, and we're going to talk about that 1-second rule. These machine learning applications are great for any task that we're doing manually that take a second or less to do, and that we don't want humans to be doing. Or we only want to do it with some sort of machine learning human hybrid. And so we're going to do that to take some sort of tedious, repetitive load off of our skilled team. And maybe it's going to be reading cases and assigning categories to types of cases. So someone can look and assign those all manually, or someone can look and calendar sessions manually. But maybe we could, in fact, do this task in a second or less. And so we were going to define the problem, and we're going to define how it's connected to your agency goals. Then we're going to talk about collecting data and building a data set. And that's where your data team and your AI team are going to work together. Too often, the data team gets far down the road without consulting with the AI team and builds data sets that the AI team can't use. And then you have to go back to, square two, usually. So you're going to collect data, and you're going to prepare that data in a way that you can use it. Then we're going to train a model. If this is a machine learning task, we're going to evaluate that model. We're going to improve the model. And we're going to really come up with a test model and then use it on real data to see how effective it is until we start to get pretty good at whatever task it is that we've designed for our organization. There are a lot of interesting things that could possibly be done, including tasks, natural language processing tasks like crawling through notations and medical records to look for folks who are high risk for suicide. These things can be done with a machine-human hybrid, where some sort of AI product or data science product could then work in tandem with a human on the back end to rapidly identify things that humans couldn't do. There's not enough time in the day to pour through hundreds of thousands of medical records and notes. So what we're going to do is flag 600 for review, and then a human can do that. Well, it's important to know that it's not just magic, that there are stages that a project goes through to get there. And being able to clearly communicate that to leadership helps. And I promised you not just 5 things that we could do now, but 5-ish things that could be done. And so in the event that you do these 5 things and you're meaningfully using data science, you're all good. Everything's done. But mental health has an extra challenge, and this is the ish challenge, that many times when we're looking at putting these kinds of applications into a mental health organization, we're doing something that's never been done in an industry or in a way that has its own unique ethics and different laws or regulations governing it. So it's really important that we creatively use our ethics that already exist and our standards and practices that already exist to come up with novel applications. So we're still thinking about privacy and autonomy and doing no harm, but what does that mean when we're anonymizing or de-identifying data that we plan to store archivally indefinitely? What is the standard for doing that with a mental health note? Then we have an ethical standard, we're applying it to a novel thing, and there may not be a lot of publications yet. And so we would want for industries to understand that you explain to a mental health person, you're so good at taking these abstract concepts and applying them to novel solutions. You do it all the time in therapy, for example. So we're going to do this creatively. And when we do this, we're going to share what we do with others. We are going to publish, speak on at conferences, and create standards so that we can bring along the rest of our field. I'm Dr. April Foreman. I am so glad that I could be with you even by recording because I may not be able to participate in this conference, but I hope that you'll contact me or keep in touch. And if your organization or an organization you know implements something, I hope you'll let me know what worked while we bring our whole industry around. This is how I think we're going to get to better mental health and fewer deaths by suicide across the world. And thank you so much for having me.